Today, we're going to dive into how new AI, specifically a platform called TriageOne, is tackling one of the biggest headaches we all share, just trying to navigate the healthcare system. We're going to walk through the entire journey, right from that first symptom all the way to the final insurance settlement.
I mean, we've all been there, right? You're not feeling well, you reach out for help, and suddenly you are completely lost in a maze of phone calls, paperwork, and just waiting. It's confusing, it's definitely frustrating, and it's a huge problem that technology is finally starting to fix.
So let's start with the core of the problem, which, let's be honest, can feel like one long, anxious waiting game.
Does any of this sound familiar? You wait for hours, maybe even days, for a callback. When you finally talk to someone, the advice is confusing. You talk to someone else, you get different advice. Your case gets sent to the wrong department, and oh, the paperwork, it just never seems to end. It's this cycle of inefficiency that drives everyone crazy.
Now, the system isn't broken because the people inside it aren't trying. Not at all. It's overloaded because so much of it is still done by hand. Think about it. Staff spend countless hours on administrative tasks, and that creates these massive bottlenecks that end up directly impacting you, the patient.
So, the solution being proposed is to bring in a new kind of first responder. Not a person, but an AI that's designed to be that first point of contact. And it's instant, and it's intelligent. And wow, the difference here is just night and day. The old way, it's slow, it's inconsistent, and is pretty much limited to a 9-to-5 schedule. But this new AI-driven way is instant. It's consistent every single time, and it's available 24/7. This shift means human staff can finally focus on what they do best, actual patient care, instead of just routing phone calls.
Okay, so let's see how this actually works. Imagine you send a quick message to your clinic's AI assistant, and you start with something pretty urgent and straightforward like this. Right away, instead of putting you on hold or in a queue, the AI starts a real clinical conversation. It's asking these dynamic, smart, follow-up questions to understand the context and how severe this is. Just like a trained triage nurse would.
And based on your answers, the AI makes a really critical decision. Is this an emergency? Is it urgent? Or is it routine? And then, boom, it automatically sends your case to exactly the right people with all the necessary info. There's no delay, no waiting for someone to read a message. It just happens.
So, once you're triaged correctly, the very next step is getting that appointment booked. Let's take a look at how the system handles this completely automatically.
See, the system doesn't just stop at triage. It figures out the correct specialist for your issue, it finds the earliest available appointment, books it for you, and then automatically updates the hospital's electronic health records, the EHR. That entire nightmare of coordinating schedules is just gone.
And this is what you see on your end, a simple, clear confirmation with everything you need. It even sends you the intake forms ahead of time, so you're not trying to juggle a clipboard and your insurance card in the waiting room. It's all about making the process totally seamless.
All right, so the appointment's booked. Now we get to the part of the journey that, let's face it, many people dread the most: insurance. It's so often confusing and stressful, but this system is aiming to simplify that too. The problem is really simple. The whole process feels like a black box. You have no idea where your claim is, why it might be delayed, or what that final bill is even going to look like. It creates so much anxiety for patients and for providers. So, the solution here is a multi-layered approach. It's about giving transparency to patients, using AI to double-check claims for errors, and even using new tech like smart contracts to make payments happen way faster.
First, and this is maybe the most important part for the patient, you get a dashboard. Seriously, just think of it like a tracking number for a package. You can see exactly where your claim is in the approval process, and you get clear updates in plain English. No more guesswork. Now for the tech that makes this whole thing fast and secure: smart contracts. I know it sounds techy, but the easiest way to think about it is like a digital vending machine. Once the insurer verifies the claim, that's the condition being met, the smart contract automatically spits out the payment. It's instant, it can't be tampered with, and it's completely traceable.
So let's pull all of this together and really look at the total impact of connecting every single step, from the moment you feel that first symptom to the moment the final insurance settlement is made.
When you automate and integrate the entire journey like this, the transformation is pretty dramatic. Let's look at the side-by-side.
I mean, the results here speak for themselves. You go from manual calls and endless delays to instant automated triage. You go from inconsistent accuracy to AI-driven logic that's the same every time. From a frustrating, uncertain experience to one that is fast, clear, and trustworthy. every single pain point we talked about is directly addressed.
The key takeaway here is that this isn't just about one cool piece of software. It's the end-to-end integration that really makes it a game changer. It's always on, it communicates clearly, and it's truly designed from the ground up to reduce patient stress and build trust.
And that really leaves us with a final thought. This kind of technology gives us a real glimpse into a possible future. A future where getting healthcare isn't like navigating a maze, but more like a clear, supportive path from start to finish. I mean, what would that change for all of us?